In the following video, find out how to properly maintain and store your MESI ECG module. Battery. One battery charge is enough for more than 100 consecutive recordings. To charge the battery, place the MESI ECG unit on the charging station. During the charging process, the light on the unit will be flashing yellow. Only when completely charged will it start flashing green. While in storage, the battery needs to be recharged every 3 months to avoid accidentally over-discharging. The device should also be inspected by a qualified service engineer at least every 12 months. Cleaning instructions. It is recommended to clean the MESI ECG unit and patient cable regularly with a soft, damp cloth. Do not use aggressive cleaning agents or excessive force when cleaning the device. Make sure to dry the equipment before next use. Do not wash the patient cables or immerse them in water. For disinfection instructions, please consult the instructions for use and follow your institution's protocols. Troubleshooting. The light indicator doesn't respond when the multifunction button on top of the MESI ECG unit is pressed. Place the MESI ECG unit on the charging station and let it charge for at least half an hour before retrying. If the light doesn't start blinking either on the charging station or after charging for half an hour, please contact your local MESI representative for further assistance. The ECG application will not start even though the MESI ECG unit is paired and next to the MESI mTABLET. Make sure that there aren't any devices that produce electromagnetic interference nearby. These devices can interfere with the basic functions of the MESI ECG unit. If the problem persists, please contact your local MESI representative for further assistance.